As we age, our body undergoes several changes, and one of the areas most affected is the cardiovascular system. The heart, like any other muscle in the body, also feels the effects of time. Therefore, in old age, it is essential to take special care to ensure that it continues to function efficiently and with vitality. A balanced diet, light physical activity, and medical monitoring are essential to preserving heart health. But there is one component that is often overlooked, but which can make a huge difference: vitamins. In particular, there is one vitamin that stands out when it comes to strengthening the heart and protecting the elderly against heart disease. Today, you will find out what this vitamin is, how it acts in the body, why it is so essential for the elderly, and what you can do to ensure optimal levels of this substance in your body. As the years go by, the risk of heart disease increases considerably. Hypertension, accumulation of fatty plaques in the arteries, called atherosclerosis, heart failure, and heart attacks become more frequent after the age of 60. This happens for several reasons. The metabolism slows down. The body starts to produce fewer antioxidants. There is a tendency towards chronic inflammation. The absorption of nutrients decreases, and a sedentary lifestyle, combined with an unbalanced diet, can further aggravate this scenario. All of these factors contribute to making the heart more vulnerable, increasing the need for extra protection. And that's where vitamin D comes in, the protagonist of this conversation. Although it is popularly known as the sunshine vitamin, its effects go far beyond helping with bone health. Several studies reveal that it plays an essential role in the functioning of the cardiovascular system, especially in older people. Vitamin D directly contributes to the efficient contraction of the heart muscle, as it regulates calcium levels in the body, and calcium is essential for muscle function. When vitamin D is at adequate levels, the heart can beat more strongly and regularly, favoring blood circulation throughout the body. Another fundamental role of vitamin D is in regulating blood pressure. It acts on the kidneys, controlling the production of the enzyme renin, which directly influences blood pressure. Studies show that a deficiency in this vitamin may be linked to hypertension, which in turn is one of the biggest risk factors for strokes and heart attacks. In addition, vitamin D has anti-inflammatory properties, helping to combat silent processes that damage blood vessels and cause the formation of fatty plaques. By maintaining balanced levels of this vitamin, the body can prevent or delay the development of atherosclerosis, a dangerous and often asymptomatic disease that narrows the arteries and increases the risk of fatal complications. Another important point is that vitamin D deficiency is also associated with the onset of cardiac arrhythmias and heart failure, serious conditions that affect the quality of life of the elderly. Therefore, maintaining good levels of this vitamin is not just a cosmetic measure or aimed at bone health. It is a true cardiovascular prevention strategy. The problem is that vitamin D deficiency is extremely common in old age. This is due to several factors. Older people tend to be less exposed to the sun, wear more covering clothing, spend more time indoors, and, as the skin ages, the natural production of the vitamin decreases. In addition, the use of certain medications, such as omeprazole, corticosteroids, and cholesterol medications, can interfere with the absorption and activation of the vitamin in the body. Common signs of vitamin D deficiency include fatigue, muscle pain, weakness, increased propensity to fall, difficulty concentrating, mood swings, and even unregulated blood pressure. Therefore, a medical evaluation is essential. But after all, how can you ensure the adequate amount of vitamin D in your body? There are three main ways. The first is controlled sun exposure. The best natural source of vitamin D is the sun. It is recommended to have between 15 and 30 minutes of direct exposure to sunlight daily. especially on your arms and legs, preferably before 10 a.m. or after 4 p.m. It is important not to use sunscreen during this short period, as it blocks the production of the vitamin. However, even with this exposure, many elderly people still cannot synthesize enough of it, which is why diet and supplementation become essential. The second way is through a diet rich in vitamin D. Foods such as fatty fish, salmon, sardines, tuna, liver, egg yolks, fortified milk and dairy products, and some types of mushrooms contain this vitamin. However, the amount provided by food is generally small,